Hello, everybody, and thank you for being here. I'm the first speaker of a series of speakers at lunchtime, so feel free to eat your food, and we'll talk you through. My name is Germana Sanna, and I'm a field application scientist with Gyros Protein Technologies. Today, we're going to just talk a little bit about the tools that we can offer to you to accelerate PK screening in preclinical studies. First of all, who we are. We are an automated, scalable, and cost-effective miniaturized ELISA. And what are the benefits of using us? We're going to go directly to that. Easy to set up, fast assay development, fast data turnaround, small sample volume. That comes very handy when you're doing PK. Wide dynamic range, and also regulatory compliant. So in addition to that, I would like to point out the fact that we're going to talk about a couple of kits that are important for PK and TK. But one of the peculiarity of our platform is that 90% of our customers use our platform as an open platform. So meaning for your specific assay with your specific reagents. We're microfluidic automated assay. Obviously, because it's automated, the robustness of the assays and the reproducibility is very high. We work on CD-based microfluidic. This is the start of our technology. It really looks like a CD, and it has microstructures, including a micro-affinity column, which is streptavidin coated with 15 nanoliter of streptavidin. And the assay is a classic assay. It could be different formats, like this one, streptavidin beads. The capture is biotinylated. Your analyte and the detection is Alexa Fluor 647. So what happens is that the laser reads the fluorescence of the detection, translates into a response, and translates into a quantification. Two systems, high throughput, 5 CDs, and 1 CD, which is low throughput, depending on what kind of capacity you need. A little more in detail, this is really kind of a magnification of how the CD looks inside. We already spoke about the microcolumn, common channel for capture reagents and washes, and then the volume definition chamber for the sample, right? So, and that's define the sensitivity of the assay. The smaller the sample, the highest the quantity that you can quantify, right? The higher the sample, more sensitivity. Please keep in mind, this is the format that we're going to use for the specific generic to GPK that I'm going to present it to you. Also, proprietary of our technology is the viewer. That's a software that allows you to look into your column and see directly what fluorescence is bound to the column. We're not going to go in details, but that's very important in terms of determining the affinity of your reagents for your analyte, because the size and the shape of the peak is what makes the specificity of the binding as well. Where do we fit in the therapeutic antibody development? With the generic kit, the generic PK and TK kit in the early drug discovery and in preclinical studies. Well, we progress into clinical development. As we said, we are an open platform. So you will be using your specific reagents for that. In addition to that, we have custom assay services. So if you don't want to do it yourself, we can label, we can do assay development. And if the assay, it works for you guys, we can also kitify the assay itself. Let's go directly to the PK and TK kits that we can offer. They were developed, obviously, to quantify human therapeutic antibodies in different matrices. Let's have a little parenthesis here. We are very well known for a very low matrix interference. Why is it that? Because it's a flow-through technology, right? So your reagents are not sitting in a well and preventing for your reagents to bind to the specific analyte. Low volume samples, again, very useful when you're doing especially PK. And in fact, with 10 microliter of mouse blood, you can do 3 different assays, namely PK, ADA, and sometimes biomarkers. So we have several kits. Shown here is the performance of the 2 kits, the PK kit and the TK kit. Those are performed in 2 different CDs. And as you can see, the dynamic range is combined about 5 logs. Specificity of this assay, different matrices, 10% MRD, 50% serum. Some more information here. Just, the very clear possibility of have a dynamic range with the two, 0.5 nanograms to 1 milligrams, right? This is just to show you we had 2 kits, 1 generic kit, and we improved our kit for the sensitivity. And as is shown here, different molecules here, different antibodies. You can see how improved sensitivity in this specific assay. CDs. So this is the CDs, as we said. They name based on the amount of volume of sample that they can accommodate. And may you need more sensitivity, we're going to push it to the 4,000 HC CD, which entitles you to use 4 microliter of diluted samples for even pushing the sensitivity of your assay even further in the sub-nanomolar, the sub-nanograms. Reproducibility. Again, we are a system which is automated. You can see here, I'm not going to go into the details. 6 run, 6 CDs, 3 operators, overlapping of the curves. Please note the very low CVs for intra-run and inter-run between them. So a little bit, just a summary of this. What was based with the kit, the TK and PK generic kit. Short time to result, 70 minutes is usually an hour per CD for getting up to 112 data points. Broad dynamic range, and the use of multiple animal matrices. I also want to emphasize that we are one of the few technologies that allows you to use neat sample. So, because of the low matrix interference. I think I have enough time to quickly go to this specific case. This was for aerofins. The purpose was to evaluate the Gyrolab generic PK in a model system. Just quickly, I'm going to show you what they did. So the assay was developed over there. They used different, percentage of serum, and they found out what MRD was the good one. Again, linearity and reproducibility of the assay as well. Low CVs specifically, testimony of the aerofins itself. Gyrolab generic PK kit only took 30 minutes to set up, and an hour. ELISA and MSD take between half an hour to a full day. More specifically, I wanted to take you quickly also to another case studies of Pfizer. This was specific for ADCs. And the purpose of this case study was to assay develop to measure the total and the intact ADC. Very briefly, this was the format that they use and that we use. Biotin label anti-human capture antibody, two different antibody for the detection, one total anti-human detection, and the specific for the payload. Results over there, you can see the difference between the total and the ADC, right? So measurement. This was a toxicology study, so higher concentration of analyte. Quickly into the results over here. Very clearly, dynamic range compared versus ELISA, much broader dynamic range. Assay development time, 2 days versus 2-3 weeks. Sample volume, 10 microliter versus at least 50 to 100. And then specific run time, 1 hour to 5 hours. And also, remember, using much less reagents to that. Summarize over there. Testimony of Pfizer case studies. This was enough for them to adopt the technology for their ADC determination. This is the application note. You will receive those if you want more information. And I thank you very much. And please visit us at booth 503. And we have a poster 109, which is basically showing you our performance in the affinity setting. And I think I was on time. Did I make it? Thank you.